welcome back to Patient Playbook. I am your host, Marcy Goldstein, with my co-host, Dr. David Feldmar, who's double board plastic surgeon. And today we have a special guest, certified personal trainer, James Hawthorn.
Thank you very much for having me.
Of course. Today we're going to talk about things that we should do to better prepare your body for surgery and things that you should and should not do after surgery.
Hi, James. Welcome. Thank you for coming. You know, one of the biggest mistakes I see my patients make is waiting till the last minute before kind of focusing on themselves before a big surgery. I think ideally you'd want to be in your best shape possible, as healthy as possible. But from your perspective, what are things that patients could start to do before surgery to kind of get themselves ready and primed for the big day?
I think, there's really three components to it. There's strength training, there's your cardiovascular fitness, and there's your nutrition. And all three contribute to being able to recover from your surgery more quickly. And on top of that, having it be a less challenging experience to go through. Nutrition is so important because the tissues need to heal, both, the incision points on the top, but also, especially in the case of, say, a tummy tuck, the muscle tissue as well. And going into it with proper nutrition, proper hydration is really going to speed up recovery. From a cardiovascular standpoint, when your cardiovascular system is working better, there's increased blood flow, which is going to bring that healing oxygenated blood to the tissues and facilitate healing. And then from a strength standpoint, with both of the procedures that we're talking about today, liposuction and a tummy tuck, having that more strength and having that muscle there to begin with makes a patient more resilient to the surgery itself and also speeds up recovery.
So one of the most common questions I get, especially on my liposuction tummy tuck patients, is, should I try to lose weight before this surgery, or should I just get the surgery done and deal with it afterwards?
That's a great question. There are no quick fixes. And as you know, these procedures aren't cure-alls. Since we're talking about procedures that kind of go hand in hand with weight loss, this may be a bad metaphor, but I like to say, look at the surgery as the icing on the cake. The cake is building the healthy habits and lifestyles beforehand so that after you have the surgery, you can get greater benefits from it. Because you can certainly undo the great work that you do with liposuction and with a tummy tuck if you don't have those healthy habits in place when it comes to diet and exercise. So my answer is get yourself in the best shape you can going into surgery. That's also going to give you probably a little less work to do, which means that the recovery for the patient will also be easier to manage if they come into it already being focused on weight loss and building those healthy habits.
I couldn't agree more. All right, so let me put you on the spot on this one. Sort of a common situation. I have a patient that has surgery coming up in about 90 days, and they want to lose 20 pounds. What would your recommendation be in that scenario?
Well, I think 90 days is certainly a long enough runway to achieve that. You're talking about 3 months, 12 weeks. Typically 1 to 2 pounds a week of weight loss can be achieved without doing anything radical or extreme. 12 weeks times 2 pounds, that's 24 pounds. So that client can definitely achieve that in that amount of time. Specifics for each client are exactly that, specific to that client. If you have a client that's 100 pounds overweight, my nutrition advice is going to be different for somebody that maybe is just 20 pounds over their target weight.
So what actually, in your opinion, determines whether that person can lose that amount of weight? Is it their age? Is it their current physical condition, their starting weight? What is it that are the factors that kind of go into that?
So that's the personal side of personal training, and all of those factors contribute. For example, a client that is maybe older has some limiting factors such as old injuries that restrict their movement or ability to perform exercise, or medical conditions. If there's somebody that has had a heart attack, for example, there's going to be limits on what we can do on the physical side. So that shifts the scale to make the focus more on diet and nutrition. Now, if you have a younger client that is able-bodied, fit, no limitations, we can work a little harder in the gym. and the diet maybe doesn't have to be quite as strict to achieve their weight loss goal. A client that's heavier can safely lose more than 1 to 2 pounds a week. They might be able to relatively easily lose 3 to 4 pounds in a week, and that might be advisable for somebody that is more significantly overweight coming into the surgery. So all of those factors play into it, and that's why it's important to have a custom plan for each individual.
I have a question for you, since it came up yesterday with one of my patients I saw for a consult. We talked about menopause and perimenopause, and a lot of time they're coming in for surgery because we can't get rid of that gut that's caused from age and being a female. Can we address on that what you can do, your tricks of your trade with surgery, how we can conquer that?
When it comes to weight loss with men and women, a lot of the same strategies and approaches apply. However, if you have a female client going through menopause, there's things hormonally that are going on that are going to change the guidelines and guidance that I give. Now, this is a situation where I like to consult with other medical professionals. I want that client to get blood work done, have that blood work interpreted so that we know what's going on the inside, and then I like to be able to consult with that professional to come up with the best plan. I want it to be a consultative thing as opposed to it being a siloed approach for that patient. So a lot of times with my clients, I'll be in consult with their other doctors. I do it all the time, for example, with a physical therapist for somebody coming out of a car accident or recovering from an injury. The other interesting thing that's different is intermittent fasting gets a lot of buzz and attention.
I was going to ask about that also.
Yes, and the answer is it works. It works for both men and women, but it works better for men just because of evolution. A female's body is set to protect, having a child.
Right.
And when your body goes into starvation mode, which can happen, say, in the morning before you have that first meal, a woman is more likely to hold on to fat. And that is a byproduct of evolution to be able to protect a child. So in times when food was scarce, women are going to hold on to fat more than men. So intermittent fasting would not be my first recommendation for a female, but it probably would be towards the top of the list for a male client, if that makes sense.
Very interesting. Did not know that.
I feel that nutrition is almost as important as surgery itself. If you were to give my patient like 3 recommendations about their diet, what they should do before surgery, what would those be? And would they be different between if they're a male patient or a female patient?
The short answer to that question is when I look at nutrition, I want to achieve results through building healthy lifestyle habits. So yes, we want to help that client lose weight or body fat, if it's not so much a number on the scale, but their body fat percentage. But I want them to have the tools to keep it off. And that is important because if they're going to spend all this money to have this surgery and have you do your work, you want it to last. You don't want them to sabotage by not having those healthy habits in place. So the top 3 things that I would recommend is 1, focus on getting your metabolism to be like a raging furnace. So never be starving, never be full. Think of it like if starving is a 1 and full is a 10, I advise clients to always stay between a 3 and a 7. And if you eat too large of a meal at once, it overwhelms your metabolism. Your body's going to store it as fat. If you let yourself get starving, the fire of that metabolism goes out and the metabolism slows. And even if you eat something healthy next, your body may store more of it as fat because it thinks that you're starving it. And starvation mode kicks in after just 4.5 hours of not eating. So I recommend people eating 5, say, bread plates worth of food, what would fit in your 2 hands, as opposed to 3 dinner plates worth of food per day. So by getting your metabolism to work optimally, that is, I think, the most important habit. Secondly, when I have my clients keep nutrition logs, nobody eats enough fruits and vegetables, and they think that they are. Half of what you eat Should be, dark leafy green vegetables, vegetables and fruits of all different colors, because believe it or not, the colors are a guide. The colors speak to the vitamins and minerals and nutrients that are in them. So a big part of what I do is coach clients on how to incorporate fruits and vegetables into every one of their 5 mini meals per day. The third most important thing is carbs are not the enemy, but white flour, added sugar, and processed foods are. You need carbohydrates for energy, for brain function, to exercise, but it's the right kind of carbs that have enough dietary fiber and protein in them so that your body doesn't process it like a sugar. In short, white flour, alcohol, sugar, it's all the same to your body.
So James, you mentioned protein and how the patient should be eating protein. How much should they actually be eating leading up to surgery? Should they be increasing the amount of protein that they're taking in? And then after surgery, same thing. Should they be eating more protein than normal?
That's a great question, and even the FDA has increased their recommendations for minimum protein intake. If a client is trying to build muscle and do so in a aggressive, meaningful way, 1 gram of protein per pound of body weight is a good goal. I recommend 80 to 100 grams for an average individual that is just trying to eat well and eat right. The old guidelines used to be 40 grams of protein per day, but your calories have to come from somewhere. If you think about macronutrients being carbs, protein, healthy fats, if you're not getting 80 to 100 grams of protein, even if you're eating high quality carbs, that ratio is probably too high. You're probably eating, too many carbs. So 80 to 100 grams of protein per day is good to get into leading up to surgery, especially for the tummy tuck procedure where there's more muscle manipulation happening in the procedure, because it's going to aid in recovery as opposed to liposuction where the incisions are probably smaller and less invasive. And then same thing, you have to keep that protein intake going. And I recommend plant-based proteins wherever possible. There's nothing wrong necessarily with animal-based proteins, but some of those plant-based proteins are easier for the body to process and deal with, as sometimes animal-based proteins exacerbate the inflammatory response, and there's going to be a lot of inflammation after surgery already.
How important is hydration before surgery?
It's critical. I think it is important all the time. So let me first set that rationale. Poor hydration and poor sleep can sabotage the best nutritional plan as it relates to metabolic regulation. If you're not staying hydrated enough and you don't have a sleep pattern that is consistent and giving you the amount of sleep you need, it can completely undo all the healthy eating that you're doing. So my recommendation for life, not just coming into surgery, is you want to make sure that the color of your urine is almost clear. It doesn't have to be totally clear, but it should be closer to clear than yellow. And that is, you have an immediate, that tells you whether you're drinking enough water. Now, if you're a very active individual, you may need to drink close to 1 gallon a day. And if you're a larger individual, you may need to drink more water. If you're more petite in physique, or you're not as active and sweating as much, it might be closer to 1/2 gallon. So that's why I say let the urine color be the guide as to what you need. And be careful for if you drink a lot of caffeinated beverages. I would also reduce those or cut those out in the days leading up to surgery, but that's definitely something that you want to talk to your doctor about first as to exactly when to cut that out. But the hydration going into surgery is critical, and then coming out of it, it's critical, because without that, your body's ability to heal is going to be compromised, because your metabolism is going to be compromised.
Good to know.
We're talking a lot about nutrition, but a lot of my patients, they're on supplements. Are there supplements that you'd recommend patients take before surgery? And are there supplements that you would recommend people avoid before surgery?
Definitely the latter. There are certain things that you want to avoid, and I know that you can probably guide your patients better on this. You want to be careful about anything that is going to thin the blood, anything that is too anti-inflammatory, because that inflammation isn't always a bad thing. Inflammation is your body's natural healing process. And that inflammation is an increase in blood flow to the area, which is necessary to facilitate healing. So in the days leading up to surgery, you want to avoid supplements or foods that are too anti-inflammatory, because that could actually slow the healing process. Some examples of that could be vitamin E, fish oil, turmeric. A simple Google or AI search can help the client see, am I eating these things? And then in consultation with their doctor, should I stop eating these things leading into surgery, and when? Now, as for supplements that I recommend going into surgery, I like to keep it simple, stupid. If you're managing your nutrition and your diet right, you really shouldn't need to augment with additional supplements. And then if they are big on certain supplements, the client or the patient, I think that they should consult with their doctor about each and every one to make sure that it's not counterproductive to the healing process.
All right, so probably, James, the number one question I get relating to this whole subject from my patients, especially here in Los Angeles, is when can I go back to working out? My patients typically work out a lot, and they're really focused on their health and their well-being, and they're always just scared about taking off, typically what I recommend, 4 to 6 weeks stopping exercise. How do you feel about that?
I think it depends on which procedure they're having done, as some are going to require a longer recovery time than others. For example, a tummy tuck is probably going to require more time away from resuming normal activity than liposuction, right?
I would agree.
Yeah. Beyond that, you have to ramp up slowly. You don't want to go back to everything you were doing right away. You want to start with gentle movement, keeping the heart rate a little bit lower. There's a few reasons for that. You get your heart rate very high right off the bat. That can be problematic for the healing of incision points, and it can also put too much stress on the muscles that were manipulated during some of the procedures. I always want clients to let pain be the guide. There's going to be discomfort after surgery. If you're doing anything physically that makes that discomfort worse, it's probably too much at that time. I think some of the things to avoid right out of the gate, even if they wait 4 to 6 weeks and they resume, things to avoid out of the gate are exercises or movements that take them through their end range of motion, and that's both to be mindful of topical healing at the skin level, and also what they can't see, which is at the muscular level. You also want to avoid lifting an amount of weight that is comparable to what you were doing pre-surgery, because that amount of strain can lead to bad form, bad technique, but it can also cause the muscle to contract to a degree that it's not yet ready to. So start lighter, keep the movements gentle, and gradually increase. And this is where consulting with either a physical therapist or a personal trainer is so important to help that client with proper program design when they resume activity 4 to 6 weeks after.
I love that. That's wonderful. So can we break down sort of like the stages of exercise after surgery, assuming the patient's been cleared by their doctor to start resuming physical activity? What do you recommend, maybe during week 1 or week 2 to 3, week 4 to 6, that type of thing?
Step 1 would be simple walking. You want to be able to get that mobility back and do it pain-free, or at least whatever the baseline level of discomfort is at that point in recovery. Make sure that the physical activity isn't making it any worse. Stage 2 would be increasing that mobility. So keeping the weight low, but doing things that expand that range of motion. If the person's a runner, they can maybe try, some slow jogging. Or if that's too high impact, they can get on the elliptical machine, which mimics a similar pattern to running, but without the stress of impact. Then I would say stage 3, as their mobility is back and they don't feel like they're, going to tear open any incision points on the skin or muscle tissue, then they can load it and start adding some weight. And then the final stage, maybe 6 to 8 weeks out, is to resume normal activities at the weights that they were doing them. If they're really athletic and they're doing explosive plyometric movements, be able to do that. But at every step, you have to let pain be the guide. If what you're doing is making the recovery feel worse, then you have to hold back until you clear that hurdle. And that tells you when it's appropriate to move on to that next phase.
And that kind of goes with, as a personal trainer, are you able to assess whether the patient's working out too much or doing too much activity for the period of time that they're in their recovery?
Absolutely. You can see what's happening at the surface level, but for a client to know what's happening underneath, there really has to be a lot of dialogue between me and that client, and me to understand what kind of person they are. If they're an overachiever type, I have to find ways to scratch that itch for them without making sure that they're not, jeopardizing the work that was done and maybe creating a larger problem. So it's really understanding what makes a client tick, meeting them where they're at.
Yeah, a simple walk here is not Santa Monica stairs.
No, they
our
have to build to
patients,
that.
right?
Yeah.
Our patients like, I just went for a walk. You said I can go for a walk, and it's Santa Monica stairs.
So specificity and clarity is important in that communication. Saying, look, the range of motion required going upstairs, especially if there's an incision down here to get that hip flexion,
right,
that's going to be problematic. And then the increase in heart rate. That increase in heart rate could create too large of a inflammatory response, cause additional swelling, which could be problematic both for the tissues underneath the surface and any incision points that are healing at the surface.
We talked a little bit about men and women and the difference for nutrition. What about working out? Should men and women, and does age play a factor in training and working out?
Generally speaking, there are differences in terms of what each population needs. So studies show that men have a higher incidence of heart disease, coronary issues. So for them, I want to make sure that their program has more cardio in it.
Okay.
And when we talk about cardio, it's working out in all different zones. So if somebody just goes on long hikes, that's great for building, aerobic.
Okay.
But we also need them to do some high intensity interval training and get them up to that 90-95% of max heart rate as well, to get them into the anaerobic. So your cardiovascular system has, multiple levels, and it's important to touch on all of them. Similarly, for women, there's a higher incidence of osteoporosis and arthritis. So there's bone density issues there. So, my prescription for the female population at large is to make sure that they're not just doing cardio, that they're doing enough weight-bearing exercise to build that bone density. So whenever I meet with a client, no matter where they're at in their journey, I like to talk to them, what have you been doing the last 4 to 6 weeks? What does your routine look like? That gives me a current level of fitness. And then I ask them, what about the last 4 to 6 months? And then I know where the deficits are in their program. Because as a client ages, we want to mitigate the chance of heart issues for men and the development or progression of osteoporosis, osteopenia, and arthritis for women. So at a general level, that's where I start.
In the consults, a lot of people ask, what if I gain weight after my surgery will go to different areas, or how do I keep it off? How do we address that?
I mean, the most important thing is hopefully before surgery, the patient or client in my case has built those healthy habits so that continuing them after surgery won't be so challenging or difficult. You know, if the client is going to, well, there's no other way to put it, be lazy and think that, all right, I did it, I got my new body, now I can do what I want. Well, it's not a preventative procedure.
And it's not a weight loss procedure. These liposuction, tummy tucks, you know, these are body contouring procedures. They're not really focused on losing weight. Now, you may look better afterwards, and you're going to look better afterwards, and you're going to be slimmer, but it doesn't necessarily mean you're going to keep the weight off. If we took off some of that extra body fat, that doesn't, you know, are you seeing that? I mean, are patients using that as their weight loss method?
I mean, I see that some people have a misunderstanding of what the surgery can do for them. They think that just because they're spending a lot of money on a procedure, well, it must cure everything. And, you know, that's why that foundation building, we don't want to build a house of cards, no matter what we're working with that client on. That's why when it comes to nutrition, I want them to build healthy habits that will keep them from putting that weight back on down the line. And similarly, if somebody says, oh, I know myself, I'm going to be kind of lazy, some of that weight's going to come on, or I'm going on a 3-week trip to Europe and I'm going to eat like a pig. I've had clients confess that to me. And my answer to them is, well, why don't you go get a stack of cash from the bank and light it on fire? Because that's pretty much what you've done. So, you know, the way you do one thing should be the way you do all things. And if you're making this investment in yourself to work with somebody like you and have that procedure, well, make sure that all the other parts of that foundation are in place. And tomorrow you will thank you greatly for doing that.
All right, James, I wanted to get a bunch of questions and just get your opinion on them, like rapid fire responses, okay?
All right.
What's in your opinion, the biggest weight loss myth?
Carbs are evil.
Best exercise if you only have 20 minutes?
Rowing, running, or swimming. If you're a sports person, develop the skills to play tennis and play singles tennis. It's the perfect sport.
If you had to choose between walking and running?
If you're able to run, run. If you can't, work with a professional to figure out what's wrong biomechanically and fix that. Most people say, oh, I can't run, I have bad knees. They don't have bad knees. There's something going on biomechanically where the knee is taking the stress of something else that isn't working right. The knee is what we call a dummy joint. If you're able to be more athletic and move more athletically, always look to do so. Don't accept that just because something hurts now, you can't do it tomorrow, no matter how old you are.
How about exercising in the morning versus the evening?
That's a loaded question. Here's the thing. Do it when you have the time. A lot of people struggle to find the time to get their exercise in. Set yourself up for success. Put that time on the calendar when you know that you're least likely to be interrupted. Now, from the scientific breakdown of this, men's testosterone levels are usually highest between 3 and 6 p.m. If they're interested in strength training, that's a great time to hit the gym. Also, people get a case of the 3 o'clocks. You have your lunch, you're kind of sleepy. Instead of grabbing yet another caffeinated beverage, use it as a way to freshen up and restart your day. Now, fasted cardio, fasted HIIT to be more precise, high intensity interval training. If you wake up in the morning, you don't take in any calories, and you do even just a 20-minute interval session. So 5-minute warm-up, 20 minutes of hard, easy, 5-minute cool down. If you do that before taking in any calories, you're accomplishing a few things. One, you're training your body to burn fat because you have no calories. Your glycogen levels are low, especially if you stop eating carbs after 5 p.m. the night before. You're training your body to burn fat. 2, HIIT training cranks up your metabolism all day long. So what that means is that while you're sitting on your butt at work, you are burning more calories than somebody who did an hour of just low intensity, steady state cardio. You got it done in 20 minutes, and your resting caloric burn rate goes up. because your metabolism is higher. So there's little biohacks and benefits to both. One of the most important things clients can do to make sure that they don't gain, those 10 to 15 pounds after surgery is to build muscle mass. So prioritizing strength training once cleared to resume those activities. The reason is that muscles burn calories just by existing. So if you look at two people's body composition, let's say you have 5'11", 170-pound male. Let's say you got two of them. Let's say one of them has 25% body fat and the other has only 10% body fat, the 15% difference being muscle mass. The person with only 10% body fat, it's going to be much harder for them to gain weight back if they have more muscle mass, because when they're sitting on their butt at work, they are burning more calories just because those muscles exist. So strength training is actually the best way to prevent fat and weight gain long term. So that's your defense to putting on that post-surgery 10 to 15 pounds.
Good to know.
All right, next question. Do you recommend weights before cardio?
I like a 5 to 15 minute cardio warm-up to get the blood flowing. It's going to help the client move better in their strength training and move more safely. Be able to go through their range of motion when under load or weight with a lower risk of injury. Now, if the client is planning on doing strength training and cardio in the same day, when you do cardio, if you're doing it right, you're going to get all kinds of sweaty. So get your weight training in first. Be nice to the other people in the gym and don't leave all the machines and mats covered in sweat. Finish with cardio and then finish with stretching. Stretching before exercise is counterproductive. When you're getting ready to lift weights, you're planning to contract muscles. When you stretch, you're lengthening the muscle and you're actually inhibiting the muscle's ability to contract and perform work. So warm-ups should be movement-based. Save the static stretches, the stretching, where you hold a stretch for 30 to 45 seconds for after the workout to improve your overall flexibility.
Very curious about this answer. Biggest nutrition mistake?
People talk about a cheat day.
Okay.
Rather than a cheat day where you just throw everything out the window, I'd rather people think about a cheat item, because that is going to sabotage your metabolism a lot less than a whole day of eating poorly after 6 days of eating really well. So, for example, if you are going to get a delicious gourmet burger, fine, but have the side salad,
Right.
Or if you're going to have a healthy grilled fish sandwich with a multigrain seedy bun, then all right, have the fries. But don't have the burger and fries and finish it off with a milkshake.
Understood.
I tell people to lose weight or body fat, you want to be an A- student. Get 90% of it right, 90% of the time. To maintain a healthy body fat and weight, be a B- student 80% of the time. And if you're super active, like if you're someone like me that's doing triathlons, you get 10% extra leeway. Those measures become 80% to drop body fat, 70% to maintain.
Very interesting. I wanted to talk about keto diets. What is your take on that?
I put it in the bucket of other fads. There is science behind it, it works, but is it the best way to go? Studies show that keto helps people lose a good amount of weight fairly quickly. But it's also pretty extreme. Transitioning to a keto diet is really rough on the digestive system. Not to be crude, but you want to make sure you have access to a toilet if you're transitioning to keto. Studies also show that maintaining a keto diet for long term is pretty hard on the body. It can be hard on the kidneys. We're just not meant to eat that way long term. So while it might help you achieve a short-term weight loss goal, I wouldn't say it's part of the strong foundation of healthy habits that you want to have. I have a course I teach called the 7 Pillars of Nutritional Excellence, and they're all about setting your metabolism up to work as efficiently as possible. I look at each of those 7 pillars as a habit that somebody can build. People that are all or nothing can tackle all 7 at once in terms of their motivation style. People that feel overwhelmed by that, I say, just pick one. Pick the easiest one. Right. 3 weeks to build a habit. Move on to the next. And in a few short months, they'll be executing all 7 pillars and not need to do or partake in diet fads like keto. Favorite healthy snack? I like to give people options for savory and for sweet. Okay. So for sweet, this is going to sound paradoxical, unsweetened Greek yogurt. Doesn't have to be non-fat, low fat's okay. If you don't like the tart flavor of Greek yogurt, leave it out for half an hour. It loses that tart and it gets kind of a sweet and creamy taste to it. Add fresh berries because they're low on the glycemic index, very antioxidant in nature. Add some flax and chia seeds for crunch. Those are superfoods. Even raw cacao nibs. While chocolate isn't good for you, 90% or higher dark chocolate starts to become a health food because it's lower in sugar, high in fiber, high in protein, and it's a healthy fat, in the same bucket as avocado or nuts. You can add that for the crunch. But be careful when you're reading the labels on yogurt. It can look healthy, but the next thing you know, you got a thing of vanilla Greek yogurt and it's got all that added sugar. But it tastes quite sweet when you add the berries and the nuts. For something a little more savory, get your favorite healthy, natural nut butter, carrot and celery sticks. That way you're getting your veggies in. That's my favorite. Remember earlier I talked about trying to help clients incorporate fruits and vegetables into every snack or meal. They can also get like an eggplant spread or a hummus. Just make sure it's not a cream-based dip. Slice up some bell peppers and some raw broccoli, and then it's easy, if you're dunking your veggies in something tasty, to just graze on them throughout the day. So if you work at the office, you have a little mini fridge, load it up with those things. And when you need an in-between meal thing, those are some great options.
One last question. One thing every surgical patient should start doing today.
No matter what procedure you may be getting, you can never ignore the pillars of good health. And it's important to start building those habits nutritionally and exercise-wise well before your surgery date is scheduled, because that will serve you for a lifetime. It will allow the money that you're spending on the procedure to be worth it, for the results to stick and to last. The surgery is going to help you look better for sure, but building those foundational pillars nutritionally and exercise-wise are going to help you feel good. And when you feel good, you'll look even better because it really comes through you from the inside out.
James, after hearing all of that, which was amazing information, it just reminds me that, I always tell my patient, surgery doesn't create a healthy lifestyle, it rewards one. And I think that you reiterated that very well today.
Well, thank you very much for having me. It was my pleasure to share everything we talked about with your patients, and so much so that I would like to continue that. And any of your patients that are interested in exploring what to do before surgery or even after, they can reach out to me via email or Instagram, and I'll spend 60 to 90 minutes with them, take them through an initial assessment, help them figure out their needs, and help them understand the best path towards achieving their goals.
I think that's amazing. Thank you so much.
James. That's
Thank
so
you.
sweet.
It'd be my pleasure.
Really appreciate it. And thank you, Dr. Feldmar. Thank you for joining us, James and Dr. Feldmar. Again, thank you all for joining Patient Playbook. I am Marcy Goldstein. We'll see you next time. Bye.